So breast augmentation is having breast implants inserted behind the breast tissue to enhance the volume of the breast. There can be many reasons for that, okay? It can be for your self-image, for confidence, or just because you wanted that slightly greater volume. One of the main reasons that our patients choose to have a breast augmentation is mainly because of improving their self-confidence or their body image. When they go through a life change, for example, a mother who's given birth and engaged in breastfeeding, the body changes and it adapts. And after an episode like that, it's not uncommon for women to say they just want to feel a bit more confident, get a bit of that projection and that enhancement back. And that's really an ideal operation for women who've gone sort of through that kind of change. It takes about 1 to 2 hours for it to complete. It's done under a general anaesthetic and it's a day case operation. So that means you can go home the same day and be in the comfort of your own home, which is a real positive for our patients. We use implants to augment the breast, and during the operation, the implant can either be placed behind the muscle that the breast sits on or in front of it. And that's something that we will decide together in the clinic. They both give you different results, so that really depends on what you're looking for and sort of the outcome that you want. So it's not uncommon to feel some discomfort after the procedure, but we will give you some good pain relief to go home with. But also we give you some local anaesthetic before you wake up, and that's quite long lasting, so you're very comfortable in that immediate post-operative period. The aftercare is really important. So when you go home, it's important that you take care to not knock that area. I ask you to wear a supportive bra day and night for 8 weeks, just as the swelling settles and whilst your wounds are healing. And all of the sutures, or the stitches, should I say, they're absorbable and they're hidden. So when you take your dressings off in the clinic, when the nurses take that off, you won't see any of that as you continue to heal on the inside. When it comes to the aftercare, you will be reviewed in our clinic at week 1 by our nurses, then again at week 4, and then you see myself at week 6. And that's where I get to see your result after it's settled and the swelling has resolved, just to make sure you're happy with everything to date.